Sure. Good morning to you on a Wednesday. It is the second day of April. I'm Art Lewis. Nice to have you with us this morning. Later on, after the 10 o'clock news, we're going to learn about Medicare choices. At 11 o'clock, the Moody Foundation will be here on Focus. But for this hour, we're going to spend some time talking about something that's been very much in the news lately and other issues surrounding our health. Because with us this morning from the Saginaw County Department of Public Health is our health officer. We say good morning to Christina Harrington. Good morning.
Good morning, Art.
Thanks for being with us today. Well, let's go right to the news, the top of the news pile, if you will. Measles has reared its ugly head in some places around the country more drastically than others. First and foremost, how are we doing with measles in Saginaw County and the state of Michigan?
Well, the good news is we don't have any measles cases in Saginaw.
Well, we're doing well then, aren't we?
Yeah. Of all the other health issues that we have, we don't have measles so far, so that's a great thing. There is 483 cases nationwide in 20 states. We do have cases in Michigan, and I think the last I looked, we have at least 3 confirmed cases in Oakland, Wayne, Washtenaw counties.
So how much of let's look at, I think the pocket of this Texas is an area.
Yes.
How much of it can be attributed to lack of vaccination for measles?
So it's definitely a factor, right? We've known that measles, although it wasn't completely eradicated, it wasn't a disease like smallpox where we've literally eradicated it from the earth, but we've virtually had no cases of measles for many, many years, dating back to the early 2000s. And so that decrease in vaccination rates, obviously measles still exists, right, in other parts of the country, largely travel related. So we live in a global, environment now. So people go travel, they get exposed to measles, they come back home, and it's very transmissible. So when you don't have a lot of high vaccination rates for coverage, you're going to see more cases. More
susceptible in young people than adults?
Typically, yes. So the very young, and it's just like many diseases, very young and very old. So the sort of teen years is where we really don't see as much measles, but in those two demographics for sure.
And I can remember, and I'm a lot older than most, but I can remember getting vaccinated when I was young for that. What is rubella? Is that the measles vaccination, or is that separate?
So it's a combined vaccination.
That's okay.
Yes, MMR, measles, mumps, and rubella.
That's what it was.
Yes. Yep,
yeah.
And that's still the vaccine that kids get today. And so one of the pieces here is that as we don't have any cases in Saginaw County, although we've seen some, the state of Michigan has seen since 2020 a slight decrease in overall vaccination rates for the MMR vaccine. In Saginaw, we're still doing very well. Our vaccination rates are great. Our childhood vaccination rates are very good. We rank second in the state of Michigan for low waiver rates. So parents who choose not to get vaccinated is very low.
How do we do so well in this and so poorly in infant mortality, obesity, where we fall off the chart? How does that happen?
Right. I think a part of it is, there's sort of the school mandated vaccine effort. So as a community, we're working hard to make sure our kids are vaccinated. And I think it's really attributed to our provider community here. So they are, when they're either at the pediatrician office or the family doctor's office, there's a lot of tracking that in terms of having conversations with parents. And our provider community here locally, I think, really understands the importance of vaccination and talks to their parents and educating them so that they can have an informed consent. So that's what I would attribute, our Saginaw efforts to specifically.
And for adults who may have had measles as a child, it lives in you, doesn't it?
Yeah, typically those viruses, just like chickenpox and shingles, right, tend to live in us for many, many years. Although people feel still at this point, if you've been vaccinated as an adult, you should be good.
But yeah, we hear if you had measles as a kid, you should get a shingles vaccine. Mm-hmm. Because that seems to be the adult problem from early childhood measles, right?
Right.
And that's nasty.
Well, so shingles from varicella, right? So that's the varicella or chicken pox is the one that tends to live dormant in the body and they can come back.
Chicken pox, not
yes.
measles? I thought it was measles.
No, chicken pox.
Okay. Oh, good. I never had chicken pox. But I got the virus. I got the shot.
Yeah.
But I never
You're
had
lucky.
chicken pox.
Most people have, right?
I never had mumps either.
Yeah.
And I had all the vaccines, you know. But it's interesting how far ahead we were 50, 60 years ago with vaccines that are still valid today.
Yeah, absolutely. I mean, these diseases do circulate, right? Particularly in other parts of the country. So, again, as we travel, most of the cases that we've seen, I think even in Michigan, have been travel-related cases.
And does the health department still offer vaccines?
Absolutely, yes. We offer everything from infants to adults. And so booster shots, childhood vaccines, the shingles shot, all of those in between. So there definitely is an opportunity for folks to get those boosters if they need them or to get those vaccines.
And is there a sliding scale for pay, or how does it work with the health department?
So we bill insurances just like your doctor's office. So pretty much any insurance, you can come walk in and we take those. If you are under or uninsured, then the health department does do sliding fee scales based on incomes, and we charge, flat rates for vaccine. And
do you do, some of the more expensive vaccines that are out there?
We pretty much do all of them. The only ones we don't is offer like the travel vaccine clinics, right? When people travel abroad, that's a specialized clinic that is usually located in Midland, but people can still do that for a lot of international travel. But everything else we offer.
All right, we're going to take a break. We're talking to Christina Harrington. She is the Saginaw County Health Officer at the Saginaw County Department of Public Health. And we will return with more after these notes. Let me take a moment to talk about Quick Lane Freeland. They're right next to my car dealer, McDonald Ford. Quick Lane Freeland is a one-stop for all of your routine maintenance for your car, and that includes oil changes and brakes and tires and batteries for any make and model, not just Fords. They work on everything from Chevys and Fords, Toyotas, Honda, Jeep, Dodge, you name it. They keep them in tip-top shape. And, of course, I mentioned tires, and you've heard me talk about tires for the past few months because they've been selling them at just $5 over cost. Now, it says here you can't do better than that, but if you stick around a minute, I'll tell you how you can. But first, I want to tell you these are brand names like Michelin, Goodyear, BF Goodrich. These are not off-brands. These are the majors. Now, I said you can do better than just $5 over cost, and you can, because some of these tires carry an additional $60 to $100 in rebates. There is extra for installation, including balancing and lifetime tire repairs. And they have a wonderful customer lounge with free internet, free ice cream bars waiting for you at Quick Lane Freeland next to McDonald Ford in Freeland. And if you're in the market for a new or previously owned vehicle, take a look at their exciting lineup and large inventory at McDonald Ford. Quick Lane Freeland at McDonald Ford.
Taxes was feeling so.
All right, we're back with you and in studio with me, Christina Harrington. She is the Saginaw County Health Officer with the Saginaw County Department of Public Health. Just out of curiosity, Christina, I think I asked you this before we went on the air, too. There's been a lot of talk about government cuts and what's happening in Washington. Has it filtered down to you yet?
It has. We were just notified yesterday that the federal stop work orders that came to the Michigan Department of Health and Human Services on federal funding, which is about $380 million directly to them, they've been navigating what does that look like, what grants specifically are we terminating and the language associated with that. So we were notified yesterday. All the local health departments across Michigan got letters around what they're calling a pause in funding at this point in time. Yeah. And so, we are affected by that. Absolutely notified that we cannot charge, any expenses moving forward at this point until we're told otherwise. For at least
any
for
expenses
us, at least,
for what? You have everyday expenses.
We do, but charged to specific grants. So
specific
we have,
grants.
Yeah, we have a grant of infection prevention. And where, as we know, public health's role is to control the spread of disease in our communities, and some of that is investigating, outbreaks, cases of reportable diseases to us. So we spend a significant amount of resources on that. It's not to say that we won't do that anymore. It's just this was one of the grants. We probably have 3 or 4 that help support that infectious disease response, and this is one of them that we no longer can charge expenses.
So does that cause
to.
layoffs, or does it temporarily reassign these people to other duties?
Yeah, it doesn't. So some of the dollars, unfortunately, because of the philosophy of this, I think even HHS was quoted of saying, COVID is over. And so what these were labeled as is COVID supplemental dollars,
yeah.
Right? So absolutely, in terms of the pandemic, COVID is over, but it's still in an infectious disease category, right? Which many others diseases are also. I mean, we just talked about measles and how contagious and infectious measles can be, like flu, all of those sort of diseases that you think of. This is, within that category.
Without getting political, is it your sense that they're kind of throwing these up against a wall to see what sticks?
I've actually used that analogy.
Okay.
Yeah, I think so. I think some of it is because, however it's labeled, tends to look. So again, COVID's over. Why would we spend any money on COVID? And so let's just cut all of those as we're trying to sort of quote unquote reduce waste, but not realizing that those dollars actually been infrastructure dollars to a public health system that's been longly underfunded, right? With very, very little resources. And so, I have 1.5 FTEs to investigate the 5,000 communicable diseases that get reported just in Saginaw County every year. So it's not a lot of, wasteful spending at the local level. So I have a real hard time with that. So I think a lot of it is, let's see what sticks. Maybe we have to backtrack and realizing this is an important function for public health.
So you mentioned 1.5 full-time employees, I assume the FTE. Has it always been that low?
It has been.
To investigate 5,000 incidents?
Yeah, it has been. And
How
that's
do they
just
do
mostly
that?
on the communicable disease. Yeah, our communicable disease nurse is a busy lady for sure.
Yes.
Not to mention on top of when we have outbreaks. So in long-term care facilities or other congregate settings, when we see outbreaks, we have a team of people then that sort of pull together to again, understand the scope of when an outbreak happens and then mitigation efforts to make sure we're, stopping the spread.
Okay, so if COVID is done, we're past the crisis, why have we been told to get a 5th COVID shot?
Well, it's still circulating, right? The disease didn't go
Okay.
anywhere, right? Just the pandemic is over. But I mean, it's going to circulate and going to continue to circulate just like flu and influenza, right? That we get our yearly, flu shots and this year, influenza A was like off the charts in terms of spread. And folks know, you didn't want to get influenza A this year. It made you very sick.
Now, is that simply because the vaccine this year didn't cover influenza A, or were people not getting the vaccine?
Well, there's always
I get the senior vaccine,
yeah,
the heavy
yes,
dose.
the high dose, the high dose version of it. So every year, the formulation in the flu vaccine is different, right? Depending on what circulated the year before, and so usually we have pretty good coverage. And so I think the coverage level, the vaccination rate, in terms of they give it an efficacy every year. So they go back and then they study and they go, okay, so for how bad flu was this year, how much coverage did we get? So sometimes it's 60, sometimes 60% effective, sometimes it's 80, 90% effective, right? And so it's never 100%, right? So I mean, we all know that none of it is 100%. However, usually flu vaccination rates are generally pretty low in the population because it's just
really?
we don't really have a super high uptake of flu shots, and that's been historical, but particularly I think around just some of the sentiments that I don't want to trust the COVID shot, so I shouldn't trust the flu shot, or I shouldn't trust shots in general. I think that also plays a slight factor.
Yeah, it would seem to me that something like a flu shot is innocuous. I mean, in its form, and every insurance pays for it, right?
Yeah, most.
I don't know
yeah.
of any that don't.
I don't know either of any that actually don't cover the flu shot. It's all usually covered in preventative
And for
services.
99.999% of the people, there's no reaction. There's nothing. I mean, it's just a shot.
Yeah.
And
And it gives you a good level of protection.
And it gives you, that's why I do it. I mean, it just seems to me to be logical, but then again, that's me. I don't tell people what they should do. I just do what I do,
That's right.
It's,
Informed consent. That's what you need to have.
yes, informed consent. That's very good. I like that. Sounds like a health department saying.
Absolutely.
So let's talk about, some of the other vaccines out there. There's been controversy and no controversy. I mean, in your opinion, how effective was the COVID vaccine?
Yeah, I think it definitely was an effective strategy. Like we said, we had tools in the toolbox during COVID, and we talked a lot about that. That no one tool was going to be 100% effective. We knew that hand washing. I mean, if we looked at the pillars of public health, it's wash your hands, cover your cough, get your flu shot. It's always right. We tell kids to, cough into our elbows. We've said that for years. Cough into a tissue. Like, we know that some of those strategies actually work, just like hand washing. If people really understood the amount that we could decrease the spread of all kinds of diseases by simply washing our hands.
Really?
Yeah. And that was one of the, COVID started to circulate, and we kept going back to these staple public health messages. And I thought, well, if anything good can come out of COVID, at least people learn to wash their hands. I mean, kids were washing their hands multiple times in school. Schools were actually taking time out of the school day and doing, to go wash their hands. So some of that is like, yes, some of these strategies work. Do they work 100% of the time? No, they don't. But the COVID vaccine also was another strategy that worked to help, right? It's all about layering those things together.
There are a lot of complaints about the fact that it came on the market so quickly. How could it be tested? But the delivery system, the mRNA, I mean, that had been developed years prior.
Yeah, it had
was just
been.
a matter of tagging on to a delivery system, wasn't it?
Yeah, it had been, studied and all of that, but wasn't just a mass produced in the vaccine environment, right? And so, going through studies, and that was all very scrutinized, of course, the speed in which it was created. And what it did is it just created an element of doubt, just enough for people to go, I don't know.
And then it was publicized
Yes.
and talked about and,
Right.
ad infinitum, ad nauseum.
Yeah, absolutely. We spent a lot of time in that.
Yeah, and then, and then the way the whole COVID thing was handled from a governmental standpoint here, elsewhere, it doesn't matter where you went, there didn't seem to be a consistency.
There was not.
It became a political issue, and that's unfortunate. When any health issue becomes a political issue, that's
Correct.
a problem.
Yeah, absolutely. And we were, unfortunately, I think spending a lot of time and sort of, if you think about the bell curve around the extreme thought process about COVID, folks that just thought, like, I can't leave my house because I'm going to die, and others that said this is just completely made up. And the majority of people lied, obviously, within that bell curve in the middle somewhere. And our narrative, we spent too much time on both ends in the narrative.
I had a saying during COVID. That when something like this happens, I don't turn to politicians for my medical advice. I don't turn to radio talk show hosts for my medical advice. I turn to my doctor, and I trust what my doctor tells me.
Absolutely. Yeah.
And that seemed to work for me.
And
because
Yes.
I escaped COVID and had all the shots and everything, but still, you just you shake your head sometimes.
yeah, you can't underscore the importance of having a conversation with your healthcare provider about any of these things. If people are really like, I don't know about the vaccine, I don't know if it's right for me, because whatever the vaccine is you're looking to potentially get, you should have a conversation with someone who's knowledgeable about that to help you get to the informed consent. Is this the right vaccine for me or not? So we can't underscore the importance of people having that. One, having a primary care provider that you can go talk to. Number one.
First and foremost.
Yes.
We'll be back. We're talking to Christina Harrington. She is the Saginaw County Health Officer, and we will return after these notes.
Sumo, sushi.
Every school, every hospital, healthcare entity was doing everything they possibly could to mitigate the spread of disease, right? Schools were, as we just said, students were hand washing. every
Little
business
decals
was
on the floor. Stand here, 6 feet here. So, yeah.
Yes, people had all kinds of things, right? Think to your business, and you know what you guys plexiglass things were up, and people were working remotely.
Well, you saw the result of this morning when you got here. Our front door has been locked since COVID,
Oh, is that?
and it became a new
Yes.
policy.
Okay.
So as a result.
As a
you know.
result, right? Yeah, and some of those strategies have caused the way to change business and the way that we do things. But one of the positive things out of it was this sense of needing to work together. And we're all, different industries are always in their silos. We're in our lanes doing our work every day, but it caused us to work with partners that we hadn't worked with before and develop partnerships like we hadn't before. So I think that's the silver lining in COVID as a community, is that we learned how to collaborate and we learned how to work together with one common vision. And we should be doing that for all of our health issues.
It's interesting that throughout the history of this country, tragedies like that change the way we do business and make us do business the way we should have been doing business. An example of that was 9/11 when it happened. All of a sudden, police departments, federal agencies who for a long time didn't talk to each other, all of a sudden now we have a communication system that works a lot better. And it's just, it takes those kinds of tragedies and serious events all of a sudden to wake us up.
Yeah, absolutely. Yeah, to think through, in the towers to hear the responders say, police and fire could not talk to one another.
Yeah.
Could not.
No, couldn't.
They operated on two completely different systems.
Not only did they operate on two systems, but even some agencies on the same system wouldn't talk to each other.
Absolutely true, too. Right, yes.
So, I mean, it made no sense.
Yeah, the partnerships just weren't there.
They weren't there.
And frankly, after 9/11, then we had a public health emergency right after, which was anthrax. And we realized as a country, when you talk to first responders, like they're really good about, those types of a bomb happens, a natural disaster occurs. But when a bunch of people get sick and we don't know why, they were like, who deals with that?
Yeah,
It was like,
you do.
Public health does. And so we were not clearly at the table at all. And so that's when we decided that, an infrastructure needed to be built around, this thing called biological terrorism.
So let's talk about that for a moment. Many people, I would say probably the majority of people, don't come in direct contact with the health department. They don't come into your building. They never have contact with you. Yet you impact their life every day if they go to a restaurant, if they do anything. Give people the Reader's Digest overview of the health department.
Sure. Usually it's we are behind the scenes, and if we're doing our job, no one knows. That's usually what we tout, unfortunately. So it's people don't know of the work that we're doing because we're preventing the spread of diseases, and by doing that, people aren't getting sick. So when a bunch of people get sick, then they say, okay, what's going on?
Yeah.
And then public health kind of comes to the forefront. But on the day-to-day basis, we're testing water quality. We're making, just as you said, restaurants, making sure that restaurants are handling their food safely so that we prevent patrons from getting sick while they eat at restaurants. We test water samples. Our pools in our county are tested every week at the health department, and making sure that people who are swimming in public swimming pools are doing so at safe levels. We're working with moms, and obviously vaccinating kids and adults is what we already talked about. But providing education, we're helping moms be better moms. I mean, all of those things that we're doing, there are certain touch points, but people always say, what's your population? Who's your clients? And it's everyone who lives, works, learns, and plays in our county is part of our client population, whether they get direct. Most of them are indirect services of the health department.
And it's amazing the things we don't know about or we don't think about. I was a perfect example of that a few years ago. I had somebody, I think it was from Saginaw County, on talking about radon. I never would have thought about it, but you offered kits.
We do.
So I
Free
went and
test
got one.
kits. Did you?
I was negative, but still,
Good.
you know, it gave me confidence in my house, if you will.
Absolutely.
And it was easy to do.
Yeah, radon's a colorless, odorless, tasteless gas that could be in your home right now, and you would have no indication.
No idea.
No indication. It's not picked up on a carbon monoxide or a smoke detector or any of those things. You would have no idea unless you get a radon test kit and put it in your home.
But lengthy exposure to it can be negative to
It
your
is
health.
the number one cause of lung cancer outside of smoking.
Oh, really?
Yes.
I never heard that before.
Yes.
Wow.
So when folks say, I never smoked a day in my life, and I don't understand why I'm getting lung cancer, potentially could be radon exposure. And radon does exist in the environment. So it can seep through, particularly if you have basements, and it can seep into your home. And literally that gas can be in your home and you have no idea.
Who's available to get these kits?
Anyone, any resident in Saginaw County can get kits. We do.
Do you have to pay for it?
We usually offer in the month of January, and then usually in the fall sometime we offer free kits for anyone to come pick them up. But we try to get them out to the township offices too, so people don't have to come into the health department. So we've offered that. And so I would say you can call the health department. We may have some kits, or you can call your township office because they may have some kits as well.
All right. One more segment with Christina coming up, and it'll be right after these notes.
Rocket Grab Plus.
Serious health issues. And so our three priorities are obesity and related chronic disease, maternal and child health, and mental health and substance use. And we said, we're going to go all in. We're going to keep that all in philosophy that we had during COVID. And we're going to put resources behind doing not the things that we've just been doing, because I always love Saginaw because I feel like we're so resource rich, but we have great resources, but our population is small enough that we can truly be impactful when we want to talk about changes in health outcomes.
All right, let's talk about one of those.
Sure.
The first one you mentioned, obesity.
Yeah.
Yet Saginaw County, everything I've ever seen said we're number one in the state.
Yeah. Unfortunately.
That's not a good number one.
No, and we struggle. We're one of the least healthiest counties in the state of Michigan. Because we have some of the most obese people. And we know that obesity leads to some serious chronic conditions. So what does that take? So, obesity and high blood pressure and all of the other things associated, diabetes, those are chronic conditions that really deteriorate people's health over time. And so that's one of the main contributing factors of why we're one of the least healthiest counties. And so we said we need to think of strategies and interventions differently about what we can do. It's not just about moving more and eating better, although those are two really important pieces.
There are just two different words there: strategy and intervention. Strategy, I understand. Mm-hmm. What do you mean by intervention? Who intervenes?
Intervention means what do we put in place to change the trajectory? We want to intervene the number of people who live with being overweight or obese in our county. So that intervention, that's sort of a health and a public health lens, is saying we're going to do this because we want to impact these outcomes.
Yeah. A lot of people would hear that word and go, oh, they're coming to my house, knocking on my door and saying I'm too fat.
Absolutely not. Absolutely not. We know it's about empowering people, too. So we have a public health summit on April 11th at SVSU, where we're going to talk about all three of these priority areas. Do some more education. The public is invited. Our public health system partners are invited. Our medical professionals are invited. We've got pretty much something for everyone in learning about these three important initiatives, in addition to a lens of equity. So how do we make sure that we're taking disparities that exist within our populations, right? Looking at the data, and why are some populations more affected than others in all of these different areas, and what can we do about it?
This is a difficult question, but if we look at the minority community, are they treated differently in the medical world? Or is there a lack of desire to acquire what the medical world offers to them?
So we know and saw definitely during COVID about distrust in the system, and I would say in the healthcare system. And that goes back for generations, right? of underserved and underrepresented populations. We also know that vastly, it's, you have to pick one of the things we learned most about creating an equity council and talking with underrepresented groups.